Now this time we went to physiotherapist also or to a chiropractor as well, but it didn't help out. Then he only suggested us to just meet a surgeon and get again MRI done. So that's why we came to you.
Okay.
We also went to a tantrik.
Tantrik Baba?
Yes.
Okay.
Like somebody told us, we were not aware of that he's a tantrik Baba. We were like, he gave some acupuncture sort of, and we were like very scared when we saw all that like puja and all they were doing.
Yeah.
So we got scared and then we looked at each other, me and my husband, and we left
in between of that.
Immediately.
With that whole scene.
And we were like, okay, we are not doing all this. And we left there.
You know what? I've at least operated a couple of patients. This is the first time I'm hearing Tantrik Baba doing slip disc illaj.
Because
today, how is your leg now?
Now there is no pain in this. Like, there is little numbness.
Yes.
And but I can move my leg.
Can you lift it up now?
Yeah.
That's mind blowing. Like
yes.
you can. So tell me, if I ask you an average percentage of relief right now from the thing you were suffering yesterday,
I would say 99% because that pain is not there at all.
At all.
Only surgery pain is there.
Is there at the back of this? Yes.
And because I'm having painkillers, due to that I think so numbness is there.
Numbness is there.
But otherwise that pain is nowhere.
Gone.
Yeah, it's gone.
Forever.
Yeah.
So thankful and so happy to the God and Almighty. Yes.
Yes, I'm very happy with that.
That's great. Okay, did you try to walk?
Yes.
You were able to walk now?
Yes.
तो मेरी पेशेंट है साक्षी मैम। मैम आप कहाँ के रहने वाले?
मैं मेरठ
के रहने वाले हो। मैम अभी जैसे आप मेरे पास आए हो, आपको लेफ्ट लेग में पेन है, इसकी थोड़ी सी हिस्ट्री बताओ मुझे, कैसे, हाउ डिड इट स्टार्ट?
It started 4 years back. So I got like a small injury in my back. I was in mountains and I got slipped there.
Okay.
So that time what happened, there was no pain that time. After 10 days it started paining in my back area, left side back area.
Okay.
And then it started moving towards my left leg. So we went to physiotherapist also, and that time it got recovered like within 1 month. I was fine. But now it's been 2 weeks. I just sneezed while standing. So because of that, I think so, it got worse. And it came back also. That previous pain, it also came back, and I think so it's more severe this time.
So tell me one thing. In these 4 years, it never came in between, or it did kept on?
It came back, and it was like by physiotherapy or chiropractic, it used to go back. Yeah. So I was fine with that. Like within 2-3 sessions, I was always able to like walk properly. Yeah. But now this time we went to physiotherapist also or to a chiropractor as well, but it didn't help out. Then he only suggested us to just meet a surgeon and get again MRI done. So that's why we came to you.
Okay. So when we checked, she already had one herniation which was irritating, and there was a herniation on herniation. We call it acute on chronic herniation, which currently led to her symptoms. And I think this time the symptoms are quite significant than before.
Yes.
Are you able to walk?
With right leg it's fine, but
can you walk with both the legs?
No, with both the legs. It's like my left leg, I cannot touch full feet on floor if I'm not having painkiller.
Okay, it's extreme pain.
It's extreme.
Like you came down to emergency, I think 3 days back, and then you were in extreme pain.
Yes.
Yeah. So I think that's why we are using the pillow also, and you cannot even keep the leg straight right now.
No, I cannot.
No, if you try to make it straight, the pain will come.
Yes.
So quite significant amount of pain she is in right now, and it's big, huge herniation on the MRI. And we propose to do endoscopic discectomy on her today.
Yes.
So, how do you feel about it?
I'm nervous, but yeah.
Stressed?
But I'm just waiting to get this pain out of my body.
Yeah,
I'm just waiting for that. Yeah.
I think basically it's nervousness or whatever, but then you know that it's staying back for last 4 years, and you need to just chop it off from its root.
Yes.
You need to finish it and you want to live your life back.
Yes, yes. That's
So let's try to do the best thing and let's try to do the endoscopy for her and then try to solve the problem. And I'll ask you again, how do you feel after the surgery?
Yes, sure, sir.
ठीक है मैम?
Yes.
Okay, take care.
Thanks.
तो साक्षी मैम हमारी पेशेंट है.
Yes, sir.
मैम कल हमसे हमारी आपसे बात हुई थी.
Yes, sir.
और कल आपने मुझे बताया था कि ये वाला पैर सीधा भी नहीं हो पा रहा है ना?
Yeah, I was taking pillow support.
You were taking pillow support and you were suffering for a long time.
Yes.
So today is the first day after surgery and what kind of treatments I will start from the little bit of backside. What kind of treatments you've already taken before surgery?
Yeah, initially I started with physiotherapy and it went for like 2 months. Means it's like daily physiotherapy I have taken for 2 months.
60 days.
60 days. Initially it worked out, but later on the pain came back when I stopped doing that.
Okay.
Then we went to some spine centers as well.
Okay.
And they recommended us surgery that time also, but we ignored it, like we were scared of spine surgery.
Certainly.
Yes. Then we went to chiropractors.
Yeah.
And we also did like home visits of chiropractors. Like,
okay.
They did fairly enough for me, means from their end.
Yeah.
And it also worked out initially.
Yeah, you got some relief at least.
Yes, yes. Because it's since 4 years.
Yes.
So it was like coming back and going. It was like that. And then we also went to a tantrik.
Tantrik Baba?
Yes. Okay. Like somebody told us, we were not aware of that he's a tantrik Baba. We were like, he gives some acupuncture sort of and that gives relief in pain, in leg pain, in back pain. So we went for that.
Like Tantrik Baba giving relief to?
Yeah, and we tried that as well. But
it must be in a village or something.
We left in between only. When we came to know like he's doing all those stuff, he's not doing any acupuncture. Okay. We thought he's like some Ved
kind of thing. Yes.
We were not aware. Then we left in between and now
that must be a very frightening. I'm like just wondering.
We were like very scared when we saw all that like puja and all they were doing. Yeah. So we got scared and then we looked at each other, me and my husband, and we left
in between of that.
Immediately.
That one scene.
And we were like, okay, we are not doing all this. And we left there.
You know what? I've at least operated a couple of patients. This is the first time I'm hearing Tantrik Baba doing slip disc ilaj.
Because we heard like in villages, people do have knowledge of all that. Like they do acupuncture.
And that works.
Yes. So for that reason we went.
Okay.
But he was not doing any of that thing.
Oh my God. That's amazing.
He was doing some puja and all.
Okay. And then, so then that was over.
Yeah. And now last 6 days, 2 weeks now. Yeah. I was suffering from severe pain.
Very bad.
And then again we started with chiropractor. Yeah. But he also said like, this is too bad now. You just do again MRIs and check with the surgeon. Then we came to you. Okay. Yeah.
So yesterday when we talked, you were not able to walk even a step.
No.
Step walking was very difficult, right?
Yes, yes.
And today, how is your leg now?
Now there is no pain in this. Like, there is little numbness.
Yes.
And but I can move my leg.
Can you lift it up now?
Yeah.
That's mind blowing. Like you can yourself lift it.
Yes.
Yesterday it was difficult.
I was not even able to lift for 10 degrees. It was like that.
But right now it's like fully 80-90 degrees is possible.
I can do that.
That's amazing. And we also checked your power. So there is no power loss. It's full power even after the surgery and before. Yes.
I was scared about that only.
Yeah. Because ma'am had ossified disc and we told her that sometimes in very rare cases you may end up losing the power for some days. But because of endoscopy and very thin scope we used, very thin scope leads to very little nerve retraction, and that's why the power is totally full, complete, 100% as compared to the right and left legs. So tell me, if I ask you an average percentage of relief right now from the thing you were suffering yesterday?
I would say 99% because that pain is not there at all.
At all?
Only surgery pain is there.
Is there at the back of this, yes.
And because I'm having painkillers, due to that I think the numbness is there.
Numbness is there.
But otherwise that pain is nowhere.
Gone?
Yeah, it's gone.
Forever?
Yeah.
So thankful and so happy to the God and Almighty.
Yes, I'm very happy with that.
That's great. Okay, did you try to walk?
Yes.
You were able to walk now?
Yes.
Comfortable?
Yes.
That's good. You try to do some steps before me. Dr. Sumit came.
Yes.
Acha. Let's come to the last part. I want to know, like, since you have been told multiple times that this is the last thing you want to do, you will lose your legs and all those. People would have told you all kind of stories.
They were like, you could be on bed for lifetime. You can lose your senses and legs. So all those things people told me. That's why I was scared of spine surgery.
I got it. And it's like, obviously, if somebody tells you, and especially somebody close to you tells you.
Yes. Till yesterday, many relatives called and they were like, why are you going for a spine surgery?
It's bad.
Yeah, but we didn't listen to them.
I get it. So tell me, there must be a lot of people right now as I talk to you suffering from the problem.
Yes.
You wanna tell them something who are trying different methods and things are not working?
Yes. I would say one thing only. Try physiotherapy initially, because initially it helped me. But in my case, I think so it got severe because I just sneezed, I told you, like while standing, and there was a hit on back that time. So if you could get like relief from physiotherapy, you must try that. Or chiropractor initially. But if the pain is going in your leg, if there is a sciatica pain, which we call, and if you feel any numbness, then I think so you should visit a surgeon, spine surgeon. Because that is like initial stage of having a worse pain. Because for me initially it was only numbness and little pain, and gradually it increased so badly. So
that you were almost the leg was restricted. This was so bad that I was little fearing that if we don't operate you, maybe you start losing the power in the leg. It was so bad. So it was almost the right time she reached us. We did all the paperwork things and then we operated, and we are so lucky.
Within 3 days we did all of this. We came to you 3 days back. So I'm grateful that I came to you.
No, it's just the God, I think, which helps, ma'am. You want to comment about the hospital and the services and the doctors? You want to say anything about this place?
Yes. I didn't feel any problem here. Everybody is very supportive. If I'm just pressing the bell, nurses are coming directly, and whatever I'm asking, even for small, minute thing, they are doing that.
They're doing it
with a smile.
That's great. That's great. And how was the surgical experience? If I want to talk about the endoscopy, what do you think now? Like when you got up, what was your reaction? Because
I had C-section, so I was having that in my mind, like I would be having pain when I'll get up. Because in C-section, when you get up first time, you would means it was severe pain.
Very severe pain.
Because stitches are here.
Yes.
I was having that imagination in my mind. But when I got up, I was easily walking. So it was a happy face for me. The doctor was also smiling. And he was asking me, why are you smiling? Like, I thought I'll be in pain.
Too much pain.
But there was no pain for me.
That's mind-blowing. That's mind-blowing. So it's a beautiful success story of yours. Yes.
I'm very, very happy.
So are we. And thank you for giving us this opportunity to operate upon you. And I just hope that people who are suffering would not suffer for a very long, and they'll go to a spine surgeon after advice, and especially surgery like endoscopy is a boon. So it's a very little pain. I don't think you have a lot of discomfort. Mild discomfort at the area outside. We did a rental lamina endoscopy under anesthesia, and she's doing too good right now. Thank you, ma'am.
Thank you, sir.